Howdy fellas, it's great to have you back, and as promised, here's part 2 of the in-flight medical emergencies video. If you haven't watched the first video, please do that. There might be some interesting and useful vocabulary. For now, let's continue the topic and talk about more medical problems on board. And to do so, I'd like you to focus on such words as seizure, attack, or episode. They are all very close in the meaning and will perfectly help us describe some individual disease events. In general, when we say seizure, we mean a sudden attack of some disease, but in particular, it most commonly means epileptic seizure. It's a result of a brain disorder, and it usually causes uncontrolled shaken movements, which are sudden and involuntary. Among other symptoms, there might be also foaming at the mouth. Apart from the epileptic seizure, the cabin crew might witness a diabetic episode. Simply put, it's a situation when one of the passengers suffers problems with blood sugar level. Besides, some passengers might suddenly experience a panic attack or an attack of aerophobia, which I'm sure you know is fear of flying. There are various symptoms that might accompany a panic attack, for example, extreme anxiety, inadequate behavior, outbursts of rage, or hysteria. By the way, that might be also symptoms of some other psychiatric or mental disorder. Another specific medical issue is an acute asthma attack. Obviously, it's a situation when a passenger experiences difficulties with breathing. You might also need to be able to describe such typical symptoms of asthma as coughing, shortness of breath, and chest pains. As you remember, we have covered some of this vocabulary in the previous video, but they fit here well too. Okay, it's time now to unveil an important yet common medical issue of an obstetrical emergency on board. Obstetrical is a formal term used to describe a situation when there is a pregnant woman and she's about to give birth to a baby. Actually, that's not the only way to render this idea. For example, you may use the phrase to go into labor. Quite often, you might hear someone saying she's in labor, or a young woman went into labor mid-flight, causing the plane to divert to the nearby airport. For those who assist the pregnant woman in this situation, would that be cabin crew or a doctor or a nurse who happened to be on board that flight, we use the term to deliver. For instance, a doctor aboard helped deliver the baby. Or often you might hear an argument that flight attendants are normally not trained to deliver babies. If all that obstetrical emergency is already a done deal, you can simply say she has just had a baby. We are requesting an ambulance upon arrival. Alright, in the next part of the video, let's talk about medical equipment which the crew might need to use in case of an emergency. It all starts with the first aid kit, a set of equipment and medications which are required when dealing with non-life-threatening injuries. For more serious issues, there is an emergency medical kit. Linguistically, there is no need whatsoever to go through their entire content, but for a few exceptions, it would be prudent to add at least the following words to your vocabulary: bandages, arm and leg splints, adhesive tapes, a blood pressure cuff, an oxygen mask and cylinder, a CPR mask, and probably syringes. And of course, that goes an AED, which stands for an automated external defibrillator and is used for heart-related emergencies. It's a portable device designed to deliver an electric shock to a heart that is not beating properly. As for some bigger pieces of equipment, we should definitely mention an ambulift, a stretcher, a wheelchair, and perhaps an infant incubator. The ambulift is designed to transfer stretcher-bound passengers to the ground and vice versa. Or, a passenger with reduced mobility was provided wheelchair assistance at the airport and on board the plane. And finally, let's devote a few moments to the topic-related actions and the verbs that help us express those actions. For example, let's try to answer the question of, what will you do in case of an in-flight medical emergency? You will generally provide or render medical assistance. You will monitor, observe, assess the condition, meaning you will try to evaluate the situation. You will check for the presence of pulse, or you will check vital signs. You will identify the illness or injury. You will give treatment, or you will treat, like in treating a wound or dressing it. You will certainly apply a bandage or an adhesive tape. You will use or utilize first aid equipment. In some cases, you will need to immobilize the injury and lay the passenger down. Probably you will ice the injured area. You will administer or simply give oxygen. Likewise, you will administer medicine. You will rest and reassure passengers. And another good one here is you will isolate the passenger. Okay, that has been a huge load of information, and hopefully you found something new and useful for your aviation English. So let's call it a day for now. Check out the description below the video for downloadable materials, and also check out our websites for more aviation English activities. Don't forget to share the video, or give us a comment if you feel like you have something to say. Alright, see you in the next video. Cheers!